Welcome to the March 2019 SCR Connections webinar. I'm so happy so many of you were able to join us this morning. I'm extremely pleased to introduce today's speaker. I'm going to try to get her name pronounced correctly. It's Ucheoma Akobundu. It's a beautiful name, and we're so excited to have her with us this morning. Dr. Akobundu is a registered dietitian and serves as the Senior Director of Nutrition Strategy at Meals on Wheels America, where she leads the development and implementation of the association strategies on nutrition and malnutrition. She also serves as the Director of the National Resource Center on Nutrition and Aging, awarded to Meals on Wheels America by the Administration for Community Living of the U.S. Department of Health and Human Services. Dr. Akobundu holds a master's in nutrition with a concentration in public health from the University of Massachusetts Amherst and a PhD in nutrition from the University of Maryland, College Park. We're so happy for her to be here with us today. Good morning, Uche.
Good morning. I hope you can hear me. Thank you so much for the lovely introduction. And hello, everyone. Thank you for taking time to join us today. It's my pleasure to be celebrating National Nutrition Month with you by offering a few remarks about nutrition resources that are available to older adults in the community and online. So without further ado, let's get started. So I'm chatting with you all today and on a presentation called What's Nutrition Got to Do with It? Nutrition's got a lot to do with it, and so we'll talk a little bit more in the presentation here. Great, so we'll get started with just some information about the topic of the day, focusing on older adults and why that matters. A few facts and figures for your consideration. As some of you may know, our nation's senior population is growing rapidly. We know that at present, 1 in 5 older Americans is 60 years of age and older, and certainly as more and more turn 60, we know that that number is sure to increase. With advances made in medical care and social support, we are enjoying at present a older average life expectancy today than so many years past. However, with the doubling of the population, and we know with this growth, there will also be a growth of folks in need of resources and those who are tending to chronic illnesses. So we know that there's definitely a need for more and more support for folks as they get older going forward. Sadly, we know that these changes in the population leave more and more Americans at risk of hunger and isolation. We know that at present, nearly 9 million seniors face the threat of hunger. That is the uncertainty for sure as to where their next meal may come from. Coupled with the fact that so many seniors live alone, 1 in 4 do, and those who feel lonely or isolated from their communities, you know that all of this couples to ensure that, sadly, those who are at risk for not knowing where their next meal will come from are at a disadvantage on appreciable health metrics than their peers who are more secure in how they're able to access food resources. This is a challenging situation and one that we know that we would like to address as a nation. There are threats that challenge getting older in our current society and strain available healthcare resources and our economic situation. Many of you may know certainly that the costs associated just with healthcare are growing, and with that, those costs attributable to malnutrition in seniors is rising as well. We do know that sadly, among those who, if you will, are the most expensive or draw down the most resources in terms of our healthcare dollars are proportionately a small proportion of the senior population. We see here on this particular infographic on the bottom of the slide that 5% of seniors on Medicare account for almost half of all expenditures. So we do know that those who are most at risk are those who need the greatest support, highest level of resources, and continuing to do health care and support for our seniors in this way is not sustainable. We are pleased, though, to be able to be part of a movement, part of a nationwide group of programs and individuals who are participating in Meals on Wheels Nation, if you will. It is a key federally supported program designed specifically to address the needs of older adults. Even with this program in place, we know that still there are so many who do not receive the community support that they would need to address functional or access challenges that they would have. At present, we know that 83% of low-income and food-insecure seniors do not receive the home-delivered meals they need. This is based on reports from a Government Accountability Office report indicating that this was the case. So even with this program's existence, there are still so many more seniors that remain unserved. When you look at this as more of a continuum of need versus an isolated episodic need, we know that there are challenges to what we will call nutritional vulnerability across the continuum of care. So while there is a lot of conversation around health care and health needs, we know that the health or the well-being of folks is enjoyed and experienced outside of the four walls of the healthcare environment. So in the community, we know that there are risk factors that challenge a senior's ability to maintain adequate nutrition status. These are psychological, emotional, social, environmental, biomedical, and challenges as well. So changes to one's social situation, a loss of a spouse, for instance, moving from one state to another, one's home-based resources may also limit access to the right nutrition support. Say if an individual is to be admitted for an acute care episode at a hospital, we know that sadly most seniors in the community are malnourished upon admission. This is because malnutrition is a lot more prevalent among the population than folks might be aware. Now, by malnutrition, I know often that conjures up images of folks who are physically appearing to be malnourished, but malnutrition is any nutrient imbalance, either an over intake of nutrients or an under consumption of nutrients that do impact one's health. Sadly, often when folks are admitted to healthcare settings, there isn't that attention to nutrition screening that should occur to identify what factors might place folks at risk for poor nutrition intake, what emotional, psychological, or environmental factors, for instance, might be at play. There is a focus often on the acute care condition that brought folks to the healthcare setting, and that's important, but often sometimes it happens at an expense of that nutrition care. Say during that hospitalization encounter, we know that hospitals or acute care settings are challenging places to get good nutrition. Often there's a focus again on different kinds of tests and procedures at the expense of nutrition. We know that sometimes it's not possible for nutrition professionals to see every client in the healthcare setting that may have a need. During mealtimes, for instance, where folks might just need some company or assistance with meals, that often is challenging to obtain. Just being immobile, lying in a hospital bed, for instance, for any more than 72 hours impacts our muscle structure as well, further challenging our nutrition status. And also, there's some interesting research emerging about just the perception of the threat that being hospitalized or in a hospital might invoke in a client. And that also challenges one's desire to eat and to take care of one's nutrition status. So there's several challenges or threats to maintaining adequate nutrition in the hospital setting. As folks leave that hospital or healthcare setting and transition to other settings of care, say a skilled nursing facility, a rehab facility, or back home, we know that sometimes during these transitions, there is not that handoff of nutrition information for each individual. So then often that leads to limited follow-up when that person is in that next setting of care as to how their nutrition should be supported. So when you look at this across the continuum of care, from the community through healthcare encounters and through returning home or to other healthcare settings, there is a challenge often in making sure that that adequate attention to nutrition is supported for all folks moving through this continuum. And so knowing that, it's important for us to be aware of the community services that are available for older adults so that those connections can be adequately made depending on where folks are. So let's talk about the services for older adults, and I'm going to just review the basics to make sure that everyone is familiar. So there is such a thing called the Aging Network. This is a partnership between federal, state, tribal, and local agencies that support and provide the needed services for older adults in this country to remain independent in their communities of choice. There are local agencies that provide support. These include what we call area agencies on aging. These are regional programs or organizations that provide a range of long-term services and supports necessary, again, for older adults to remain at home and in their communities. Of the range of services that are provided, and I'll be sharing a little bit more about what those could be, nutrition services are among the most popular provided to those who are seeking them. So let's dive into this a little bit more. So this is a visual representation of what this aging network looks like, and I'm going to walk you through, starting from the top of this diagram to the bottom. At the top, we have AOA. This stands for the Administration on Aging. This is the federal program office charged with administering programs throughout the country that provide support for older adults. Under this federal program office, there is another layer. These include 56 state units on aging and 264 tribal organizations. So at this level, these state-based or tribal organizations have jurisdiction under them to ensure following or the establishment of a plan on aging. Underneath these state and tribal organizations are area agencies on aging that have regional jurisdiction to carry out the plans with regards to how aging services are provided. These 618 AAAs, we call them, area agencies on aging, again then execute on that state-based plan to provide those supports. Underneath the area agencies on aging, if you will, this work is supported by thousands of service providers. These are local program agencies. You might know them as Meals on Wheels organizations, senior centers as well, and volunteers provide support to 1 in 5 seniors in this country. This results in many millions of meals being provided, many millions of rides to and fro, places where seniors need to go, many millions of hours of personal care, homemaker services, and chore services, again, to provide those supports that folks need to remain independent in their communities of choice. In addition, there is respite and other services provided to caregivers across the country. Thousands of these individuals are provided support through the Aging Network. There's also supports in terms of ombudsmen to ensure that if there are any challenges to accessing needed support, there are legal ways to examine those challenges and provide restitution. All of this is to say there are many players in supporting the needs of aging across the country. The beauty of the system is that responsibility is shared across the state, federal, and local levels to provide for the needs of older adults in their communities across the country. So, say in your local community, how would you happen upon any of these local service providers that are rendering services for you, for instance, or folks that you might know? When we look at particular meal services, how do folks happen upon getting meals? We can see, looking at this chart, what kinds of entities provide referrals for meals. For instance, looking at this chart from left to right, we can see that the light blue bars here represent home-delivered meals, and the dark blue bars represent congregate meals, or these are meals that folks can access in a community-based setting like a senior center where folks congregate to have these services. We see here from left to right then, looking at where do referrals come from, we see that hospitals, healthcare facilities, or discharge planners are more likely to provide referrals to home-delivered meals. That's the light blue bar. There are care management systems, again, mediated by the Aging Network, and we see that almost 50-50 in terms of the kinds of referrals made for meal services. Individuals also self-refer. When they identify that they individually have a need for meals, they're also able to call that area agency on aging, that regional organization, to provide services or seek out services that they may need in terms of nutrition. Many jurisdictions have information and assistance systems. These might include systems such as 311 or other local area opportunities for finding access to information. These information systems are also able to refer folks to receive, say, home-delivered meals or to a congregate meal program. Friends and family are also important referral sources, and you can see here on the right-hand side of this chart that friends and family are the most likely to refer folks to receive community-based meal services, more so than hospitals, more so than even a self-referral. But lots of ways for folks to identify the need for meal services and get connected with their local organization within that larger aging network. So what are the community-based services that are available for those seeking them? Again, as noted, there are two service settings. For folks who are not able to leave their home, there is the home-delivered meal option. For those who are able to leave their home, have access to transportation, one can access congregate meals. Again, these can be offered in a variety of settings. Sometimes they're at libraries. Sometimes these are offered at senior centers. Sometimes I know that we have a program in New York, I believe that offers congregate meals at a local farmer's market. Again, every community is able to design how these services show up, if you will, to meet the needs of their seniors in their locality. Some of the basic nutrition services that are offered are meals that are hot, cold, frozen. In some places, shelf-stable meals are also provided, particularly in places where weather can be inclement, so that seniors have access to meals even if there should be an emergency or inclement weather where it's hard for those meals to be delivered, for instance, to the senior, or difficult for them to go out to that congregate site to access the meal. As needed, there are special diets that are also offered, so seniors can have access to renal meals, pureed meals, low-sodium meals, diabetic-friendly meals as well, again, based on the local program and the needs of the senior served. There are also ethically and culturally appropriate meals, kosher, halal, different preparations to ensure that the full range of need is being met. In addition to meals, I would say that we call the other services that are offered the more than a meal plus suite of services. So in addition to meals, many local senior serving programs offer other services. These include medication adherence assistance, for instance, home safety, nutrition, as we noted, transportation. Fall prevention services are also offered. Services and programs that meant to address social isolation are offered as well. End-of-life care increasingly is becoming a service offered in the community, in addition to health risk assessment and, of course, support for caregivers. So this certainly is beyond the meals that many Meals on Wheels and congregate meal programs are known for. So I want to talk to you a little bit today about what is Meals on Wheels America. We know that there are Meals on Wheels programs in your local communities all around the country. You may be familiar with some of these programs, but what is Meals on Wheels America? What do we do here at the national level? So here are some insights onto the basics. We are a national leadership organization supporting the interests and needs of over 5,000 local community programs across the country. We provide them advocacy, education, research, and national partnerships so that they can go forth and meet the needs of their seniors. Meals on Wheels America is a membership organization whose vision is an America in which all seniors live nourished lives with independence and dignity. We want to make sure that we can leverage the existing Meals on Wheels network to keep all seniors healthy and independent at home where they want to be, but also save billions in tax dollars by keeping them out of more costly health care alternatives. We are headquartered in Arlington, Virginia, and are able to provide this support through the nation. We are a united network serving the most vulnerable. We collectively support the needs of more than 2.4 million seniors by delivering nutritious meals, friendly visits, and safety checks so that they can meet their unique needs. Recent research that we have conducted indicates that we serve a vulnerable population. We know that a senior who requests Meals on Wheels services is significantly more vulnerable than the average American senior, as demonstrated by these graphs on this chart. 71% of seniors who report needing Meals on Wheels report that their health is fair or poor. This is in comparison to 26% only of average seniors. Nearly twice as many seniors on Meals on Wheels waiting lists report depression and anxiety compared to the average senior. We know that 80% of seniors needing meals are physically unable to shop. This is as compared to 23% of the average senior. So taken together, we are able to provide support to a very vulnerable population across the country. We also espouse the message that we are so much more than the meal as a network. Again, in addition to that nutrition service that we are known for, we also provide safety services as well, looking at safety within the home, looking at opportunities to provide socialization to seniors, particularly those who are homebound, and serving as the eyes and ears to address senior needs, connecting them to the services within their community that they need. We know that the impact of Meals on Wheels is huge. We can provide a senior Meals on Wheels for roughly 1 year, which is the same as the cost of 1 day in the hospital. We know that those who receive Meals on Wheels report falling less often. Falls, as we know, cost our nation $50 billion a year. So being able to attenuate falls in the home through meal services or an association of meal services is really important. The service is impactful. National data suggests that 81% of those who receive these services indicate that it improves their health. 92% say it enables them to live at home, and 90% say getting these services makes them feel safer and more secure. You are welcome to visit us. We can be found at mealsonwheelsamerica.org. You are welcome to surf on over to our website. It's easy to find a meal if you are searching for home-delivered or congregate meal services for a loved one or for someone that you know. On the Meals on Wheels America website, right on the landing page, you're able to enter in the center of the page into our Find a Meal program. Just enter a zip code and click Go, and you're able to identify local programs in your area as needed. In order to support this network in doing the good work that it does every day, it's so important to make sure that they are ready to provide the services now and with an attention to the needs of seniors in the future. So we provide also targeted training for the Meals on Wheels network of professionals providing this service in their communities, so they are keeping on top of trends and being nimble and providing the services for the future. Some of the key drivers of the work that we do, some of the drivers that change our work, are these noted here. So at the top left, I want to call your attention to a campaign that we had most recently called Seniors Can't Wait. The social media campaign was to draw attention to the growing waiting list for services in some communities. The funding available for community-based senior services is discretionary, meaning that it is not an entitlement. This means that services are provided when funds are available in that local community. So in some communities, this means that there is a waiting list for services. We also know because the need is growing, because as mentioned earlier, the population is growing, this is an urgent situation and certainly a key driver of us as we look to the future. Another key driver for us is moving over to the right. There we see the little chess pieces. That is to indicate competition. As with any industry, there are always competitors in the marketplace. I'm thinking of traditional taxi services, for instance, who now have Uber and Lyft as competitors. That's no different in our industry. We always want to use the opportunity for competition to refine and better target our services to serve our constituents. Moving over to the right one more time, I have another image there to illustrate another key driver. That's called impact investing. The world of philanthropy is changing, and more so, donors and funders are very much interested in understanding what is the impact behind every dollar that's invested. This is an important question and one that shapes the kinds of work and opportunities we leverage to engage the philanthropic community in ensuring that they see great impact for the funds that they provide, our organization and the local organizations across the country. Going down one, we see that I've included here an image of a puzzle piece, set of puzzle pieces. The one that's being held is one where it's written collaboration. More and more so, collaboration and partnership are important to leveraging available resources in any community. More and more so, local senior service organizations are being encouraged and see the opportunities to partner with the healthcare industry to ensure that that continuum of health that I talked about earlier is in fact a continuum, that no one slips in between the cracks, that folks are provided nutrition services wherever they are to ensure their health. This is to make sure that folks have access to needed services and access to high quality of life as well. The last image here is one that we spoke about early in the conversation. This is to indicate what we often can call a silver tsunami. This is the growth in the population of older adults. This growth is important, but it certainly provides some urgency around the work that we do to ensure that these key drivers of our industry, we attend to them and are able to help our local programs position themselves for success in the future. That brings us to the National Resource Center on Nutrition and Aging. This resource center is an important part of our strategy for future-proofing our network of providers. This entity allows us to be able to serve as a platform for training the provider network so that they are on trend and being able to deliver services well into the future. In 2011, Meals on Wheels America was awarded a 3-year grant from the Administration for Community Living, as was mentioned at the top. Since then, we've been able to offer and host the National Resource Center and provide a platform to engage a number of stakeholders to provide them the needed training and insights into the future of how services need to change and adapt to meet the needs of older adults in this country. You are welcome to visit us at nutritionandaging.org. There you are able to enter search terms, find resources that would be of interest to you in the realms of nutrition and aging. What is the NRCNA, the National Resource Center on Nutrition and Aging? We are an online resource center with our primary goal to equip the aging network with timely, relevant, high-quality education and training opportunities, again, so that they're able to stay on trend and provide services to meet the needs of current-day seniors and seniors in the future. We seek to strengthen the capacity of the Aging Services Network, integrate this network into the larger arena of home and community-based service providers, and provide them the needed training and technical assistance to do their job excellently and into the future. This is your NRCNA team. I'm joined by my colleagues Elise Hernandez, Sammy Heffron, and Sharon Coral to provide the training and education resources that are needed. Our job is to disseminate resources, engage in outreach and marketing such as with this presentation here today, and grow our stakeholder community so that we can provide additional training and raise awareness about the resources that we have. Our audience is far and wide. This includes the Aging Network, as I mentioned earlier. We have great interest from our healthcare community, public health program professionals in any a multiple of settings. We are certainly providing services for consumers, health and nutrition advocates, registered dietitians, academics, and so much more. You can find what you need on our website at your fingertips. Our site is enabled for optimal viewing on any device. We provide programming that really focuses on 3 key areas where we feel that are necessary to focus on for senior nutrition programs. This is focusing on nutrition, health, and aging, food service operations, and smart business. It may surprise some to focus. It may surprise some that we have a smart business focus, but we know that mission-driven organizations are businesses, and in order to remain viable and sustainable into the future, a focus on business acumen, sustainability, and social entrepreneurship is really important. And so we provide training and technical assistance to support our provider network. You are welcome to visit us again online and have access to thought leadership documents, research reports, training, and technical assistance in these key areas as well. We have some information on public policy, and you can certainly visit our training and events section on our website and see upcoming webinars that we have to offer as well. So where do we go from here? You all have received great information today that we have resources at mealsonwheelsamerica.org in addition to nutritionandaging.org. Our real focus is to really address the needs to remain successful, to scale great interventions and programs such as the National Resource Center so that we can support the sustainability of our network. We really want to remain attentive to trends in our changing business and service provider environment and attend to the needs of our stakeholders, folks like you. What kinds of resources would you like to see? We welcome your insights. We welcome recommendations. There's an opportunity through our website for you to suggest resources that we can offer and host on our website. We want to continue to provide the tools, resources, training, and technical assistance needed from our stakeholder community. Again, we do this through online webinars and in-person training as well. Our job ultimately is to showcase resources that help support successful aging, both in the community setting and online, and we welcome your partnership in that area. Before I close my presentation today, I really want to leave you with one thought. We are certainly offering more than a meal. We know that the nutrition part of the Meals on Wheels message is often what we are known for, but these programs across the country do so much more. They attend to the in-home safety needs of older adults. Volunteers at the doorstep are able to check in the home and identify any risks that might be present as well. We're also able to attend to the needs for socialization of seniors. This is for folks who are homebound, who perhaps are not able to leave their homes, in addition to folks that are ambulatory, who are able to go to congregate meal programs, senior centers, for instance. That piece of socialization we know is so important and a key component of health and well-being. Ultimately, programs like Meals on Wheels serve as the eyes and ears in the homes of seniors and also at the congregate sites to determine any changes in condition, changes in health, connect seniors to any services that they may need in the community, whether folks are at home or able to be ambulatory in the community. So it is that more than a meal message that I would like to leave you here with today. There's so much more to well-being than just nutrition, even though we know that nutrition is a central part of that. So anything that you can do to support the nutrition needs of seniors this March, this National Nutrition Month, and all months during the year is really important. To borrow a small proverb from my African heritage, I always like to leave folks with this final thought. If you think you are too small to make a difference, you haven't spent the night with a mosquito. Having personally spent a night with a mosquito, I can assure you that they are very tenacious. A small thing like that can make such an important difference in the life. Anything that you can do to raise awareness about Meals on Wheels programs, connect folks in your communities with these important services is a small act, but one that is sure to make a difference in their life. Thank you all so much for your time and attention, and I will leave time now for any question and answers.
Great. Thank you so much, Uche. We will have plenty of time now for any questions that people can have. If you want to enter your questions into the chat box, I'll be happy to pass them along. I do have a question for you, Uche. You mentioned that sometimes your congregate meals are held in libraries. How would a library contact the Meals on Wheels local agency to get involved with that?
Absolutely. We welcome folks to surf on over to mealsonwheelsamerica.org website. Right there in the middle of the web landing page, you're able to enter your zip code and be offered a listing of local agencies in your area. One is able to reach out using the search results and engage with that program to identify what kinds of services already exist in the community and how best can one support them, raise awareness of them, and engage. If there is, in fact, no congregate meal program site available, one can reach out to the Area Agency on Aging. I'm happy to share that resource, Sarah, after this call to determine what they might recommend. Again, each of the local programs are part of a state plan on aging. It is that larger plan that each state puts together to address the needs of older adults in their state. And so programs are set up, established, maintained in accordance to that state plan. So plugging into local programs, plugging into some of those regional actors can help one get a sense for what are the resources that exist already and how can one provide support for gaps in that service array.
Great. Thank you so much. It really does help us all get a better sense of how we can partner with Meals on Wheels. And that's one of the comments here that we have is that one of our librarian partners has been thinking about volunteering, and this will help get people inspired to get involved. Another comment that they just really loved this presentation, and thank you so much for the very important work that you're doing. We also have someone from a regional area health education center that they're going to share the information with their organization. Uche, do you know if, off the top of your head, if there are any area health education centers partnering with Meals on Wheels? Are you aware of any of those partnerships?
I don't doubt that they do occur, particularly, say, for instance, I know that Meals on Wheels programs or senior serving programs that provide nutrition services are always looking for nutrition education as part of that. Providing meals is a good idea, of course, but nutrition education so folks understand how to eat healthfully and identify the resources they need to support their health is also important. These programs are constantly looking for resources in the community, be they through local academic institutions, cooperative extension. The wonderful health resources that you just mentioned would be great support for senior serving programs so that they can tap in to the right kinds of education to meet the health and information needs of seniors.
Great, and the individual mentioned that their AHEC partners are involved with delivering meals regularly, so that's great to hear. I do have one question.
Thank you so much for your service.
I do have one question here that's for me, not for you, Uche, and that's about the recording. The recording for the session will be available on our YouTube channel. We'll also have the link to the recording on our archived webinars page on our website. I'll have our tech support put that link into the chat box in just a moment, and we should have the recording up. If not by the end of the week, by next Wednesday, it will be available for people, so we can certainly share this video. Does anyone have any other questions for Uche before we go ahead and finish out today's presentation? Go ahead and answer your questions into the chat box.
I'm so very pleased to hear there's some folks who are already working with local senior nutrition programs. I'm wondering if there's any information that I shared today that was new to folks who are on the line, anything that you learned today. I would invite you to enter into the chat box any new learnings that you have and what next steps or action steps you think might be. I'm always curious to see what is new. Sarah, if there's any entries like that that you couldn't share, I would love to hear.
Absolutely, and that's a great question for the audience as well. I know me personally, I was not as familiar with that that National Resource Center that you all had gotten the grant for, so that was really interesting to me. We have another comment that people didn't know that there were congregate meals, which is great, as you said, fighting that issue of loneliness among older adults.
For folks who are interested in participating in some of the training that we do, I encourage you to visit the nutritionandaging.org website. There's lots of resources there for you to engage with. We do have periodic quarterly webinars that you are able to listen to and participate in. We have also many of the webinars that we have done archived on the website, so you are able to listen to those even though they have passed. For those of you who may be in the Dallas, Texas area late in August, we invite you to remember and keep in mind that we are having a live training event in Dallas, August 26th. I believe this is a Monday. This is a pre-conference workshop that we are offering that will focus on innovation in the community-based meal service provider space. This is a great in-person opportunity to really engage with new concepts around innovation, how one can continue to push the envelope and be creative and offer new and interesting services in the community. This in-person event is going to be flanked by two online events, a pre-webinar and a post-webinar. We like to do learning series like these that involve in-person and online training so that folks can have the benefit of being able to learn in different settings that appeal to different kinds of learning styles. So again, we invite you, stay tuned. If you are in the Dallas, Texas area late in August, we invite you to participate in this this in-person 3-hour pre-conference workshop on innovative programs and services. Happy to share that information with you, Sarah, once that becomes available.
Thank you so much, Uche. It sounds like a wonderful opportunity, and certainly we'd be happy to pass it on to some of our local partners here in the Dallas-Fort Worth area. I just want to read some of the comments that have been coming in regarding your question. One person was interested to learn about the top referrals for meals and congregate meals are related to being given by friends and family. Really loved that you also included the health impact of loneliness. Maybe this is along with the next steps. It really makes you wonder about those who don't have resources, how they can reach the services that you offer. I think it's really great you have that finder right there on the home page of your website, so that's really great as well.
Fantastic. Thank you so much for sharing.
Absolutely. Well, it looks like we don't have any other questions at this time, other than if you would go ahead and pass on that workshop information, Uche. We'd love to have that later on.
Sure. Happy to. Thank you again for the opportunity, and thanks everyone for your time and attention today.
Thank you so much for the presentation, Uche. I do ask that everyone stay logged on for just a few more moments. We do have some final housekeeping to take care of. So thank you again, Uche.
Thank you.
All right, so first things first, I will go ahead and stop the recording.